The Parallel Pathway Programme and possible amendments to existing laws will be brought to the Cabinet this week. Ipoh Timur MP Howard Lee Chuan Hao weighs in on the importance of facilitating the effectiveness of the Parallel Pathway alongside University Masters Programme to address shortage of surgeons here.
The amendment or the debate that led to the amendment does not mean negating trainers who have passed exams, who have fulfilled their logbook requirements. They've done their required time diligently with competent, practicing, life-saving surgeons under the highest form of apprenticeship called the Parallel Pathway, paid for by KKM or the HLP by KKM, called the Parallel Pathway. Now, the reductive, exclusivistic, and I would even say monopolization of recognition and accreditation only to university master's program, cutting out the largest healthcare provider in the country, does not facilitate the national realities of our time. It frustrates and it hampers the qualification, operationalization, and getting surgeons in theaters treating patients. I think we have a job to do and we need to get the job done. If amending the Medical Act to get rid of the ambiguity is what we need to do to ensure both parallel and masters can work at maximum efficiency to accredit, to recognize, to qualify, to operationalize surgeons into theaters, saving Malaysian and human lives, I have a moral, democratic, and human duty to support. And I think the fundamental notion here is we do not want it to be exclusively KKM Parallel Pathway or Masters by University. We need both, and it must be both.
Howard also outlined the situation in his constituency, emphasizing the need for more specialists in hospitals.
Many cardiothoracic patients, let's take that as one discipline, are having to travel to Serdang, to IJN, to Penang, and other hospitals with cardiothoracic services. And that's not fair. And one of the reasons why is because we don't have enough surgeons. And if we were to go to the national context of the entire country, I think we've heard this number being put around and bandied around, which I think is accurate. By 2030, we will probably need 17 to 20,000 specialists, which is we're far short of right now. We need an expansionary approach and policy to facilitate that, to facilitate faster, whilst remaining fastidious in getting more surgeons in theatres treating patients.